Alright, hi everyone. Let us see this lacrimal apparatus and Uvea quiz along with some tear film questions as well. Let us see the first one. Which of the following is not a cause of epiphora? Now you should understand all watering of eyes is not epiphora. Epiphora is watering of eyes due to obstruction in the lacrimal apparatus. That can be seen in NLD obstruction, punctal occlusion, canalicular blockage, common canalicular blockage. Yes, in congenital glaucoma, the child has big eyes, watering, photophobia, but that watering is reflex watering due to irritation of the nerves. That is not called epiphora. Watering is the most common symptom of congenital glaucoma, but that's not epiphora. Now, 24-year-old patient present after watching movie. Just after watching movie, I know many people must have answered the question acute angle closure because that was asked in NEET exam, but that's not the answer. Painful diminution of vision, redness in the right eye, hypopyon cells in anterior chamber can be seen in acute angle closure. But addition between iris and lens is posterior synechia. Hypopyon cells that is going in favor of acute anterior uveitis. Hypopyon rules out conjunctivitis scleritis because that is outside eye. Acute anterior uveitis is small irregular pupil, posterior synechia, hypopyon cells, flare. Most common cause we don't know. Idiopathic. Treatment topical steroids, adjuvant cycloplegics. Now, even the picture is showing one segment of the retina involved that is like a pizza pie appearance, having hemorrhage and necrosis like sauce and cheese appearance. That is CMV retinitis. But let us see what are the other things. HIV is the most common cause of CMV retinitis. Immunocompromised patient present with medicine department. Symptoms of floaters, blurring of vision can be there. Dense white patches of necrosis, hemorrhages, sausage cheese appearance. That is nothing but CMV retinitis. Treatment is ganciclovir, maybe systemic, maybe intravitreal. Both can be given. Now, which of the following is done in chronic dacrocystitis? This is a Nabziger's view, head end view. This is foot end view, worm view. Worm is not the name of any scientist, ना? कीड़ा नहीं रखेगा कोई अपने बच्चे का नाम. Worm comes from foot. That is showing proptosis, bulging. This is Hertel's exophthalmometer showing measurement of proptosis. D is a regurgitation test that is done in chronic dacrocystitis. Can be in acute, but in acute there is painful lacrimal sac. That's why acute dacrocystitis is regurgitation test is not done. That is Ropla's regurgitation on pressing over lacrimal sac area. Positive only in chronic NLD obstruction, chronic dacrocystitis, because then only the mucus will be accumulated in the sac. Not in common canalicular obstruction, because then the mucus won't be accumulated in the lacrimal sac. It is positive when the mucus comes out of the puncta. So answer is D. Lacrimal pump mechanism is a structure which helps the tears to go from the lateral to medial and sucked into the system. That is closing eyes, opening eyes. Closing eyes is due to orbicularis. That is the answer over here. That forms a lacrimal pump mechanism. And in Seventh palsy, if orbicularis does not work, lacrimal pump failure will be there. There will be overflow of tears. That is not watering. That is hyperlacrimation. That is not epiphora. That is hyperlacrimation. Now, chronic granulomatous enterouveitis. Mutton fat KP is seen in granulomatous. Coepe seen in pupillary area, pupillary nodules, PP. Pupillary nodules, pupillary area in granulomatous. Flare can be seen in uveitis, but stellate KPs is seen in Fuchs heterochromatic cyclitis. That is a non-granulomatous one. So stellate is specific for Fuchs uveitis. That's a non-granulomatous one. Now, 15-year-old girl presents with painful swelling of the right lower eyelid. Painful rules out chalazion. Chalazion is a painless lipogranulomatous inflammation of the meibomian gland. Eyelid tender pus pointing at the root of the hair follicle has this Zeiss gland. So answer is A is wrong. Antibiotic ointment will help in this is stye or external hordeolum related to hair follicle or Zeiss gland. So epilation can be advantageous. Systemic antibiotic is a better answer, but ointment antibiotic can work. Topical antibiotic, topical drops antibiotic have no role. They can't enter the eyelids. Ointment can enter. So aclazion is not the answer over here. Now many people have made mistake in this. Calculate the total dose of oral vitamin A is asked. If the child is without spot, less than 6 months, 50,000 units at 0, 1, 14 days. 0, 1 and 14. 3 doses are given. 50,000, 50,000, 50,000. In 6 months to 1 year, that is this age, 1 lakh oral dose is given. 1 lakh, 1 lakh, 1 lakh. 3 lakh doses is the answer over here. Total doses is asked now. 0, 1 and 14. 3 doses are given for without spot. That is a treatment of without spot. So 6 to 1 year, 6 months to 1 year, 1 lakh on 0 day, 1 lakh on first day, 1 lakh international on the 14th day to boost the liver. That is the answer, 3 lakhs. I hope you have done well. Again, thanks for listening.